All right, well, it just turned to 12 p.m. Central, 1 p.m. Eastern, so we'll go ahead and get started. First, I'd just like to welcome everyone. Thank you all for joining. This is the second webinar in our CHAMPS Wednesday webinar, Spring Series 2021. This meeting is being recorded, just letting you all know. And if you could, please, I think everyone has already, but if you are not speaking, if you could mute yourself, that would be great. So welcome, CHAMPS, and I am so excited to welcome our wonderful panelists today. We have a wonderful group of panelists who will be sharing their expertise. They're all from different community organizations in Mississippi working to support breastfeeding mothers, and we're so excited to hear from you all today. So I'm going to begin with just a few short housekeeping slides, then each panelist will introduce themselves for a few minutes, and then we'll move on to a moderated discussion during which I'll be asking and posing the panelists a few questions, and then at the end we'll end with a period of audience Q&A. So during that time, you can feel free to unmute yourself and ask a question, or if you want to, not forget your question, you can chat it in if you think of a question during the webinar, and we will pose those questions to the panelists at the end as well. So just a few short housekeeping slides. The first is I just want to make sure that everyone on the call is aware of the next two webinars in our webinar series. The next webinar will be on April 14th with Dr. Eileen Fitzpatrick, new CEO of Baby Friendly. And then on June 23rd, we'll have our own Miss Kathy Carruthers, who will be announcing our new CHAMPS Mississippi WINS project, which stands for Workplaces Improving Nursing Support. We're very excited for those two webinars coming up as well. Again, we just want to make sure that you all know about our upcoming virtual conference, which we're very excited about, happening on May 19th. If you haven't registered yet, you can do so. The conference is free. And we have a great list of keynote speakers here, as well as many other speakers as well. Also, once you register, you'll have access to the conference platform, and on the conference platform, you can see many other details of the conference. The conference has also recently been designated for a maximum of 6 ANCC contact hours for nursing staff, and the CE credits will be free for Mississippi nursing staff. So definitely, especially if you're working in a hospital, share this with your colleagues, share this with your staff who might be interested in joining our conference. So without further ado, I'm going to hand it off to begin our panelist introductions. So I'll be handing it off first to Ms. Dr. Jacinda Roach. Thank you so much all for joining us today. I'm looking forward to great conversations.
Well, thank you so much. Hi, everyone. I'm honored. I was honored to be asked as the panelist for this virtual meeting. My name is Jacinda Roach, and I am the Programs Officer for the Mississippi Public Health Institute. And one of our projects at MSPHI is a REACH project that was funded through CDC. And as many of you know, REACH stands for Racial and Ethnic Approaches to Community Health. We were funded in 2018, and our project is called the Gulf Coast Healthy Families, Mothers, and Babies Initiative. And our priority area are the 3 coastal counties of Mississippi. So if you can advance the slide. So our project goal, of course, is to reduce health disparities among chronic disease in African Americans, particularly African American families in Mississippi, in those 3 coastal counties. And we are really directing efforts towards African American mothers because we know that they are the gatekeepers and many times to the entire family. Next slide, please. So for this project, we have 3 specific strategies that we have selected, and they include nutrition. Through the nutrition strategy, we promote healthy food access and breastfeeding. Tobacco-free living. Through this strategy, we are working in a variety of ways to educate the population, but also we're working with multi-unit housing to implement smoke-free and tobacco-free policies And then thirdly, clinical community linkages. One of our partners for this project is a large FQHC, Coastal Family Health, and they assist us in making referrals as well as a variety of other activities through their centers. They have 8 clinics on the coast and 2 pharmacies. Next slide. So as I told you, one of our main strategies is nutrition, and we are promoting breastfeeding. So we have created 3 new baby cafes on the coast, and we have made sure to put one with particular focus to each particular county. So the first one that we opened at the beginning of our project was in Singing River Hospital, which is Jackson County or Pascagoula. And remember, we began funding in 2018. So I should let you know that we are in our 3rd year of this project. So these are pictures from the grand opening that we had. Next slide, please. Now, since that time, we've created 2 additional baby cafes. One has been open at Merit Health Hospital in Biloxi, which serves Harrison County. And the third is a community-based baby cafe at the Gulf Coast Breastfeeding Center. She's located on the line between Harrison and Hancock counties and serves a large population from Hancock County. So she had a very good reach for the baby cafe. Now, we ran into a big problem, as many of you have, and that was the pandemic. So we were holding in-person meetings for Baby Cafe, and all of a sudden the pandemic hit the baby cafes, and they can no longer hold these one-on-one meetings. So we switched to the virtual platform and have found that that has truly expanded the reach of this project. They hold meetings virtually, and now patients from one county can actually attend a meeting in another county or with another baby cafe. And she's even had some participation from Louisiana, which has been really good. So the virtual platform has really expanded our possibilities in a good way. We're very pleased with it. Next slide. And we've had also several other breastfeeding activities in addition to the baby cafe. So I told you that we have a partnership with Coastal Family Health Center for those clinical community linkages. Through our partnership, we were able to house a community resource manager, and she can provide referrals to patients that come in based on their needs. So she's able to educate moms that come in about baby cafes and meeting times. She's also able to identify other things that may, the social determinants of health problems that they may have. So, for example, if they don't have access to enough money to buy food or access to a grocery store, she can give them a referral for a food pantry close to them. So it has been a really good relationship with Coastal Family Health, and she's been able to really identify patient needs. Another thing that we did to support breastfeeding activities was through the Jackson County Civic Action Committee Head Start. They were deemed as a breastfeeding friendly site. The original one was, and then they decided to take it to all of their sites. So now all 5 of their sites with the Jackson County Civic Action Committee Head Start is breastfeeding friendly. And they have a space where moms or staff members can come and breastfeed or pump throughout the day. They really support a breastfeeding friendly environment, and we were very pleased about that. In addition, MSPHI has partnered with Mississippi Department of Health to implement the Go Knapsack initiative throughout the state. And we are helping, particularly in our 3 coastal counties. So Go Knapsack, if you're not familiar with it, it's actually a self-assessment tool that will encourage centers to make changes and support practices in 7 identified areas. And one identified area is breastfeeding. So we have worked with MSDH to identify early childhood education centers in our coastal county that are interested in implementing Go Knapsack. and we were able to offer a small incentive for their participation. In addition, we have a coalition manager on the coast that has become trained as a technical assistance provider for the Go Knapsack project. And then finally, we launched a communications campaign under the acronym of SHAE, which stands for Sharing Health, Education, and Awareness. And this is a targeted community-centered campaign that focuses upon African-American women. And if you have a minute, I want you to go to our website, which is shaehealth.org, and you'll see all the materials and all the links that have been developed to support our REACH project and the SHAE campaign. And it's really taken off. We have our website, but we also have billboards in the area. We have signage in pharmacies, for example, to support the SHAE campaign. We have also been involved, as I said before, in healthy food access activities and participated in produce drops in the area. And the last one that I went to, I was actually introduced as the SHAE lady. So I was very excited about that, because that tells us that people are paying attention to our billboards and to all the materials that were developed under SHAE. And that's our REACH project. And I'm sure I'll have a chance to answer any questions at the end of the presentation, Maetal.
Yes, absolutely. Thank you so much.
And that's just a brief overview. I only had 4 minutes, so that's just a briff overview of what we're doing to support breastfeeding.
That's great, thank you. And we're looking forward to diving more into it. I've also put the shaehealth.org website into the chat in case people want to save that for later.
Okay, thank you
so much. Now we'll move on to Ms. Lambert.
Hello, everyone. My name is Jacqueline Lambert. As it states here on this screen, I am the mother of 3, breastfed 2, one for 36 months, and I pumped exclusively for 12 months. I am the breastfeeding coordinator here at Delta Health Alliance. And you see all those other things that I have accomplished throughout my time here. Next slide. Some of the things that we're doing in the Mississippi Delta with our home visitation initiative, we have several home visitation programs, and we're working to train our staff in breastfeeding promotion so that when they're with the participants, they can actually promote and support breastfeeding education. And as you see with the Delta Baby Café, I am the lead facilitator with the Let's Talk Delta Baby Café. I wanted it to be a theme that actually centered around talking versus having conversations based upon moms coming in and just chatting about what's going on. And like Jacinda stated, when we went to the virtual platform, it just took off. We found out that we had grandmothers, fathers, everyone were able to be a part of that platform. So even though COVID was kind of bad, it was an up for those who like virtual platforms. And so we have really been pleased with the outcome with the virtual settings. And with the Greenwood-LaFleur Hospital, we're working with them. I'm in the clinic on Wednesday, not today though, but I'm in the clinic on Wednesdays doing breastfeeding education with the moms who comes in the clinic. Our partnership with the South Sunflower County Hospital, helping them with the promotion and being a part of their breastfeeding task force to help with breastfeeding promotion and support. And of course, with the Healthy Families of Mississippi, training their staff as well with breastfeeding promotion. So those home visitation programs again. And so we're pleased to have a milk bank, what we call the Delta Depot, where moms can actually, if they can't get to Jackson or Flowood to take their milk, then we can actually accept their milk for them and then be able to send it for them. So those are just some little things that we're doing. We're very pleased with it, with our promotion and support that's supporting breastfeeding. Next slide. And this is just a picture of the lactation spaces that we're actually put it in our facilities. So we actually have spaces where moms can come in and breastfeed if need be. If they can't find those other places, we're open that they can come in and nurse their babies, and when they're or for employees as well, so that moms can have a space to actually nurse their babies. So next slide. And our collaboration with the Build Health Challenge grant was to help our hospital, South Sunflower County, with discharge bags. And so one of the projects that we did where we created a breastfeeding guide that moms can actually have to take home with them. And so that they can have, you know, to find out what to expect, hand expression, all of that good stuff, so that they can have something right there in their hands. So we're very pleased with the collaboration, being a part of the Build Health Challenge that we were able. And you see us putting it in, well, not us, but we have someone putting it in the car for the hospital to pick up. And so that is the guide that we created. That's the little work that we're doing over here in the Delta, trying to promote and support breastfeeding.
Thank you so much, Jacqueline. Now we'll move on. There. Becky, are you there?
Yeah, hi.
Hi.
I'm Becky Sands. I am the president of the board of directors for Mother's Milk Bank. This is how to get a hold of us. We're located on Airport Road in Flowood, not real far from the airport. Our mailing address is a private mailbox on Lakeland Drive, so that's a secure mailbox for receiving financial contributions when we do our fundraisers. There's the phone number. That's our main phone number that rings on our executive director's desk, and that is her main email to get a hold of us. Next slide. Our mission is to accept, pasteurize, and dispense donor human milk to premature and ill infants in Mississippi by physician prescription according to the standards of the Human Milk Banking Association of North America. So we are actually in the huge network of nonprofit milk banks in the United States and Canada. There are, I want to say 28 now. There was a new one that just opened last week and I've lost track of the numbers, but we were about number 21 in that. So we have been established in 2010, opened as a depot for one of our sister milk banks in 2014, and then dispensed our first order of milk to one of our local NICUs here in the Jackson area in December of 2015. So we've been doing all this for, what does that make us now, 5.5 years or so? Next slide, please. How we support breastfeeding. We support breastfed babies in NICUs directly by providing donor human milk for their exclusive use or as supplements to mother's own milk while her own milk supply is coming up. A lot of times when mothers give birth prematurely, especially if it's their first baby, they may have trouble getting their milk supply in for the first few days. And we provide the bridge to her milk. We never want to replace her own milk. That's much more important than donor human milk and much better for the baby. We provide the bridge so that they don't have to use formula in these. Sorry? So that they don't have to use formula in these tiny babies that are particularly susceptible to necrotizing enterocolitis, for instance, as well as some other things. And so this helps these premature babies get off to the very best start in life that they possibly can, and have the very best help that they possibly can. Ultimately, we would like to be able to provide human donor milk for outpatient infants in special circumstances, and occasionally we're able to do that by physician prescription, again, because we're a therapeutic intervention as well as nutrition, when we have additional supplies available. And thirdly, just by raising awareness of the importance of human milk feeding and breastfeeding for both maternal and infant health statewide, people find out that, oh, human donor milk is a thing, it must be really important. Maybe I really should breastfeed, or maybe I should breastfeed longer, or maybe if I have extra milk, I should consider donating. And so there are several studies out now indicating that in zip codes where there is a human milk bank or a hospital that uses donor human milk from a milk bank within the state, that the breastfeeding rates go up in those zip codes. So our support is kind of indirect to the mothers, but directly to the babies and the hospitals. And with Mississippi's high prematurity rates, that's particularly important. Next slide. That might be all. Okay, so our goals are to increase our presence in the state by conducting outreach programs, which kind of got pivoted a little bit due to COVID, obviously, and to cultivate a renewable supply of donor human milk in Mississippi by raising awareness of the importance of milk banking, to make human milk donation convenient by opening more depot locations. We're up to 11 or 12 locations now throughout the state. We would love to have many, many more. Several of these are at baby cafes. As mentioned, we do have one at Gulf Coast Breastfeeding Center. Stephanie's been a depot for us for years. Would love to have a couple more on the coast, so maybe we can talk later. We have one, as Jackie mentioned, at the Delta Baby Cafe. Our newest one is in Clarksdale at the Delta Diaper Bank. The Friends of Fins Depot opened there just within this last year. We had to do a virtual opening for them, but we figured out how to do that and got the job done. We would eventually like to be able to increase our services by supplying every hospital NICU in Mississippi with human donor milk. We've still got a couple that we're not supplying. We would eventually love to have enough milk supply to be able to supply every delivery hospital with human donor milk for supplementing full-term babies as medically indicated, such as when they have jaundice or low sugar or whatever. So that would be our ultimate goal. Next. That's our contact info.
Great, thank you so much. So now I will hand it over to Tawanda.
Hello, everyone. My name is Tawanda Logan-Hurt. My work roles consist of being the Northern Region Breastfeeding Coordinator with WIC at the Mississippi State Department of Health. I'm also a CHAMPS Hospital and Community Consultant for the Delta area. And I'm also a state baby cafe coordinator. But my role here today is to speak on our cafe in Greenville, Mississippi, and it's the Delta Baby Cafe. And it's facilitated by the WIC peer counselors at this moment. But we invite others to take part in, facilitating that are in a community that are breastfeeding experts as well. So we invite, others to volunteer their time to come on to, talk with the moms. But this is our flyer, and we have our contact information of our main facilitators, Maggie Allen, Patricia Jones, myself, and we're all WIC employees, WIC breastfeeding employees. So next slide. So at this time, like everyone else has mentioned, due to COVID, we have had to take our sessions virtually on the web. And so these are our links that were created by the Baby Cafe director, Lucia Jenkins. And so we have links that we include in every session in the chat for moms to click on. And we also have some codes that they could just scan if they're, using their laptop or something. They can scan those with their phone and get the links to pull up as well like that. So our experience with the virtual cafes has not been as effective as some has mentioned. Our attendance has dropped somewhat, but we are thinking of different ways to be creative to, pick it up and we'll talk more about, ways that we're looking at reaching out our area to get more support as well. But this is the way that we get people registered and sign in when they attend, so we can still keep track of attendance and know who's joining us. And also because Baby Café, we have to submit monthly reports. So this is a way for us to have our documentation to submit as required. Next slide. So like I said, we're doing different things to increase our attendance. These pictures right here just show that different ideas that we've come up with. We're having a monthly attendance raffle, and we're using this online game, this online raffle wheel. And we said every time someone attends, their name will go into the drawing. So there, you can see right here, I just included names of different breastfeeding supporters. And you can see their names are on there multiple times. So that will increase their chance of winning the monthly raffle. And we also have various certificates that are created and on our Baby Café website. Get issued to the moms as an incentive, or just a reward or acknowledgement of their breastfeeding effort and success. And we also have monthly speakers, and we come up with an idea to have an awareness month. So, and have a speaker to speak according to what that awareness month is. Like this month is National Nutrition Awareness, and we're gonna have a speaker, and we just ask for suggestions from the facilitators. Even the attendees can make a suggestion on a speaker. So we're at the leisure of the speaker on the days that they would like to present. So we leave it open, even the times, and we just make sure that we promote it by advertising, that they will be there presenting, so we can hopefully get a good attendance so they can, their information can be heard. So as of this point, we have had a presentation on lead and healthy homes. And it was a speaker from our organization, Mississippi State Department of Health, that came and presented information. And she also spoke on safe sleep as well. And we also do referrals to the SIDS Alliance, because we've had moms that have had babies pass from SIDS. So we want them to get the support that they need. And so we've made referrals to them as well. And we just leave it the way that we conduct our sessions. We still have it as a socializing event. We don't structure it as a class, because we want to still have the outline of how it was when we had it in person. We had them to just come in, socialize, get to know each other, just bring up topics that they're interested in. So we still have it as a socializing activity, or doing it virtually. And I think that's the last slide that I have. Yeah.
Thank you, Tawanda. And now our last panelist.
You're welcome.
Presley.
Hello, everyone. I am Chelesa Presley, and I am a CLE also, which is a lactation educator. I'm a doula, community health worker, executive director of the Diaper Bank of the Delta, owner and co-founder of Early Dawn's Birthing Services. And also I am the director of Clarksdale Baby University. And as was mentioned before, we did open Friends of Fins Milk Depot at the Diaper Bank, which we're really excited about. And all of this falls under our parent organization, the Delta Hub. And you can move the slide. And I am the mother of 3 two which I breastfed, one for 1.5 years, and I at the breast and pumped. And my youngest, I exclusively breastfed at the breast, no bottles or anything, for 4 years. And some of the works we're doing, the slide you have here, Crossroads Baby Cafe is the baby cafe that I have worked with for many years, but things are changing. So I will not be with Crossroads Baby Cafe. I am looking, and we will be opening a new baby cafe in the Oxford and Batesville area coming up soon. We're looking at some new names, and I will get back with everybody else about those grand openings. Some of the things we've been doing with the Crossroads Baby Cafe, we have had virtual cafe, and it was really successful due to the programs that I work with, all the parenting programs. So I invite those families who are pregnant to attend the Baby Cafe and to receive information on breastfeeding, getting started, and maintaining their breastfeeding journey. So these are just some of the pictures. You can advance the slide. So one of the things that I really want to talk about that I'm just too tickled pink about is under early dawn birthing services is proud to present, along with Crossroads Baby, along with Clarksdale Baby University, is Uplifting Mama's Community Doula Program. And what that is, we received a grant through United Healthcare, and our goal is to increase the number of people of color working in birth and breastfeeding in the Mississippi Delta. We're going to train 20 women across the Mississippi Delta and now across Mississippi to become community doulas, to work with their community, their families, their friends, their sisters, and provide this one-on-one support during birth and during their time of breastfeeding. And we had our first session, our first training on February the 26th through the 28th. It was a very intense 2.5 days of training. And Tony Hill, the traditional midwife here in Mississippi, was our presenter and trainer. And everyone that attended really had a great time. We trained 8 women, and we have some continual training. We're doing a breastfeeding training with them through CHAMPS. We're also doing some herbal classes with them. It's just amazing. We had a great time. Our next session is coming up March the 19th. So if you know of anybody who would like to be a community doula, I will have it posted on my Facebook pages, and I can send an email out to everyone. And the second goal of this program is to increase exclusive breastfeeding beyond 3 months. One of the things we notice, a lot of people are breastfeeding in our area at the hospital, but once they get past that 6 weeks, they kind of stop breastfeeding. And so what we're going to try to do is provide that one-on-one support with our community doula program to encourage them to continue breastfeeding and provide them all the resources and support they need. And the third goal of this program is to increase the rate of completed postpartum visits in Mississippi, and postpartum visits at 6 weeks. Because one of the things we've seen is that a lot of some of my mothers, once they go to that 2-week checkup, they do not return for their 6-week checkup. And this would also help with our breastfeeding. And I just want to share that all of this is in partnership with the Diaper Bank of the Delta. Please check us out on Facebook, Instagram, along with all the programs. And the last thing I want to share is that the Diaper Bank of the Delta did receive a grant from the National Association of Counties and Cities and health officials to reduce disparities in breastfeeding through continuum of care. So we did receive that grant. I will be hopefully reaching out to some of the people that are on here so we can fulfill our commitment for this grant. So we're trying to work hard in North Delta and beyond to increase the breastfeeding rates of our Mississippi moms. Thank you. And friends of friends, and we love that.
Thank you so much. Well, I think I speak on behalf of everyone on the call that this is just so inspiring to hear all of the amazing work that's going on. For our first question, I just want to pose to, there are so many of you on our panel who are working on creating or maintaining the wonderful baby cafes in Mississippi. And I'm just hoping that, any of you who would like to speak about maybe a particular instance or, one thing that's been particularly inspiring or gratifying about your work with the baby cafes. And on the other hand, maybe something that's been particularly difficult in creating and maintaining the baby cafes, especially during the pandemic.
I can start by sharing a few experiences that we have had. So as I stated in my presentation, we began with the two hospitals, Singing River and Maetal. And then our third baby cafe was with a community base with Mississippi Breastfeeding, with the Gulf Coast Breastfeeding Center and Stephanie Gable. Well, she is truly passionate about it. And she had an advantage because she didn't have to deal, and I hate to say with the red tape of a hospital, but she had her own LLC, so she didn't need approval from different levels to advertise. So in some instances, she even passed out flyers in parking lots to moms coming out of stores. For example, like Walmart, if she saw a pregnant mom, she could give them a flyer. And I think that's how she was able to build her attendance at baby cafes. And she said that, like was discussed earlier, more people are participating and they're staying on for the 2-hour session. So Tennille Collins is our program manager for Reach, and we've been talking about ways that we can improve attendance. A lot of people didn't want to go into the hospital, particularly due to the pandemic. They were scared they were going to get exposed to things. So I think we are going to move forward more with a cluster model coming up. So we will be able to house the main site as the community-based program and use the hospitals as sort of a cluster location. So they'll mesh into one huge baby cafe, but we'll cover all 3 counties. In addition, because Stephanie is so passionate and has been so vocal, she was able to get support from a local foundation through a bank in Hancock County that wanted to support the efforts of the baby cafe. So that was extremely positive for us because it's showing us more community involvement and community interest. And we want to change the whole way communities see breastfeeding. We want it to become a norm. And I think we would all agree, everyone on this call would agree that that's our goal, to make breastfeeding a norm. So that's just an example of not necessarily a problem, but a hiccup we experienced. But I have to say, I have been very impressed with our community-based baby cafe and the work that Stephanie Gable has been able to do.
Thank you. And would any of our other panelists like to add on to that, share your experiences?
I can say, just as Jacinda, as we said earlier, also that the virtual platform has been a plus, and reaching out to the moms, I just think that it's been a big plus as well, because at the time, so many people were quarantined in and could not really go anywhere, and that gave them that that avenue to still socialize with everybody. And so from what I saw on our end, that even with them sharing with their friends and things, it's just really I became a social gathering. And so it has been a plus, hoping that it can, continue on, that they can still gather together and not only just gather for socializing, but also to receive the support that they need. And then it's an opportunity also to educate family members who may not have even ever thought about breastfeeding. So that has been a big plus. And then to support those family members who didn't know how to support those moms who were breastfeeding. So that's what I will add to it.
I would like to add, for us, being with the diaper bank, it was because during COVID, we were really out in the community and we had access to a large number of the population in the state of Mississippi. And at diaper drives, we were able to get information out if there was someone pregnant or they said they was breastfeeding. We was able to give them information about breastfeeding support and the baby cafe. And that has really worked out. And also providing doula services, which I do. That was, I probably referred about 100 or so through that.
Wow, thank you. And actually, that's a good segue. I wanted to check in with you, Chelesa, about the diaper bank, as well as Becky, on behalf of the Mississippi Milk Bank. I know how you all worked and adapted to the COVID-19 pandemic. If you could speak a bit to that as well.
With the diaper bank of the Delta, previously in 2019 and before, I do want to share this is our 5th year anniversary. As of March 1st, we opened our doors in 2016. We were mostly confined within our 4 walls in Clarksdale, Mississippi. And then the pandemic, then March happened and we closed down for 2 weeks. And we had an emergency board meeting and we decided to initiate the Diaper Bank on the Move initiative. Well, we took the diaper bank outside of its 4 walls and we decided to start going to small communities in the Delta first. That was our goal, to go to 4 communities a week and set up and do pop-up drive-through. That led to everybody wanting us to come. So we really expanded and reached a lot of communities. By the end of 2020, we had distributed diapers in 55 towns and cities in the state of Mississippi and 5 communities in lower region of Arkansas. So we touched a lot of families. So that's how we were able to meet the need at the time, because at the beginning of the pandemic, there was a lot of panic buying. So we could not be still because there were families who did not have diapers. They did not have feminine hygiene products because all the paper products were gone from the shelves. So our services were in dire need. The 2 weeks that we were closed, my phone was going off the hook. So we were able to meet not only their basic product needs, but we was also able to meet some of their breastfeeding needs, some of their referrals. A lot of the participants who was on this program, on this call, were able to come and distribute information about their programs at our drives. So we were not just there for ourselves, we was there actually to help the community and the state as a whole, for everyone to kind of have an avenue for them to get their information out.
So at the milk bank, we were affected a lot by COVID, but also not at all. Our basic day-to-day operations of screening the moms and getting the shipments of milk in from the depots and processing the milk and getting it back out to hospitals never changed. We're an essential business, and that was something we're a hospital supplier. We're hospital vendors for all the hospitals that so that never changed. How we did the donor screening, however, has changed. In the old days, we used to mail out packets of papers to people. Right before COVID, we were starting to move that to an electronic format with a secure online server that moms could just log into a certain website, sign in, give us all their information, and that would email it back to us. And that transition is now complete. It probably would have been anyway, but it got speeded up. We're communicating with the doctor's offices to get their approvals electronically. We were already doing by fax. Now we're able to email things to them much easier. We still have the 10-minute phone conversation that every mom has with our donor mom coordinator, Christy, because we do like to have an actual relationship with our donor moms, and she either calls back or emails them about every 2 months still. So we're doing that. We believe she has actually incorporated a way to text moms now too. So we've got some additional virtual thing. The main way that it affected us a lot was that we used to have in-person grand openings for all of our depots, and we'd throw a big party and order a cake and feed everybody lunch and, you know, have balloons and prizes and things like that. And now we've had to go virtual with that. When the one opened with Chelesa, they did some in-person stuff with their local people that was all very COVID safe and everything, but we were not able to travel because of the travel restrictions. And so our milk bank staff Zoomed in, I believe, did they not, to do kind of a virtual welcome for that. And then we blew it up all over our social media. That's the other big change we've had, is that we have a much bigger social media presence, not in the last few days because we're between outreach coordinators right now, but we were able to hire through a grant from the Bauer Foundation an actual outreach coordinator to manage all of our social media accounts for the last 6 months. Unfortunately, she had to quit for health reasons. We've just hired a replacement who is onboarding this week, as a matter of fact. So we're going to be able to do much more of that on social media and virtually and that kind of thing. So we have enhanced social media outreach, and we hope to get back to some in-person depot openings and have it be back to a big social event and have press releases, although Chelesa did a great job of getting the local press to hers. Thank you for that, by the way. And have that be an in-person thing again when it's safe. So that we will keep the social media presence. We want to get back to in-person when we can hug people and thank them in person, face to face, for helping us out, and thank the moms face to face and give them their t-shirt face to face when they bring their milk donations. We had intentionally planned with our current Kellogg grant to have a lot of milk drives. And we're in the middle year. 2020 was year 2 of a 3-year grant from Kellogg to do a lot of milk drives, which is really hard to do virtually. We tried to do some statewide ones in connection with World Breastfeeding Week and Prematurity Month and that kind of thing. And those were moderately successful, but not nearly as successful as in-person that we had done in the past. So we hope to be able to get back to in-person ones for that as well. But still with great social media advertising, because that always helps too.
Great, thank you. And I guess just a more general question for all of the panelists now, speaking to kind of the pandemic and these needs that maybe we didn't know were there, and now we've been able to, you all have been able to serve even to a greater extent with these new virtual depots and baby cafes and things like that. I'm wondering if you all, any of you would like to speak to, you know, some new spaces in breastfeeding support that you think that the COVID-19 pandemic has really brought to life and brought to light, either ones that you have been able to, through your work, start to work on, or ones that you hope to work on in the future.
I'll start. I think one of the things that came to light was the importance of having a doula and that need. The pandemic really brought out how important it is for a woman, a mother, to have someone there supporting her. And with the restrictions, the COVID-19 restriction and the social distancing, that really put an emotional and mental strain on a lot of mothers and a lot of families. And it really brought that out, that we need people. we need each other, and we really need that one-on-one constant support during times. So I think, and that's something that we're working to build on, because even during the, in the height of the pandemic, there were, trying to do virtual breastfeeding one-on-one session was a little difficult for moms, how to hold, especially if they had no support system to hold the camera so I can see what's going on with their breastfeeding, and to provide that one-on-one support and, being there. And, what I did was I started going to the local pediatrician's office. So they would go in for their visits, and the pediatrician would invite me there to provide breastfeeding support during their appointments, to provide that distance, but they needed that actual person to do that. So that's what.
Yeah, like Chelesa said, it was a little difficult when you're doing the phone FaceTime videos, trying to help moms. And we realized at that time, home visits can't stop, right? So what do we have to do? We got to put our mask on, we put our shields on, and we just go out and help moms. And that, you're worried, but yet you're more concerned about helping the mom. And so that concern for helping the mom outweighed the concern of getting COVID. So you do your precautions, you wear your mask, you wear your shields, and then you help that mom, because the support is needed for those moms who did not have that support. And then that is where that doula intuition kick in, and you want to be there to support and comfort that mom, and you do what is necessary. Not necessarily went to a pediatrician office, but our home visits never stopped with the moms. And so that's one thing that I was so proud of with our organization, that the home visitation programs kept moving, and they kept meeting the moms, and they kept seeing the moms, and then offering that support and that education that the moms needed, that the families needed.
Yes, I would say that the pandemic brought it even more to light that moms need this education and information about what to expect when they go in to deliver, because the hospital practices changed so much due to safety, and they were limited on who they could bring in, that the moms need to get that information early on during the, and then she needs to invite her partner, her support person that's going to be there with her in the hospital, because they're limited, to be in that education as well, so they can be knowledgeable and be aware and just know what to expect when the mom goes in to deliver.
I would say something else that the pandemic brought to light was the need for infection prevention and cleanliness, right? So one thing that we would like to see happen is we would like to see more businesses within our priority area become breastfeeding friendly and have safe, clean spaces for our moms to pump or breastfeed. So that's one area that we're going to focus upon within the next few years, actually next year. So.
Great. Well, thank you so much. I do have some more questions, but I'm going to go to the chat now and see if any of our participants have any questions. I see one from Jen Nicholson that asked Chelesa if you can tell us again who funded the doula training.
The doula training was funded through a grant through United Healthcare insurance. So that was the funding that we received for the initial start of the class. But I do want to share this. It is so funny because when I did my post about recruiting for the class, I put it on all my social media sites and all my groups I'm in, and I received over 50 people interested in this doula training, and they were from all over the nation and the U.S. territories. And I was just overwhelmed. I had people from Hawaii, the Virgin Islands, and they were really interested in coming to this. And I was like, well, it's really for Mississippi and for women in the Delta. So I am currently working on some funding to offer this class, this session throughout the nation. So the interest is not just us, it's a lot of people wanting this.
Thank you. Wow, that's truly amazing. Any other questions? If you want to unmute yourself as a participant, or just if you want to send a question in the chat for the panelists. Probably have time for one or two more questions.
This is Laura from CHAMPS.
Hi,
I just
Laura.
wanted to jump in and just ask, so I know there's a lot of other people on the call, obviously from Mississippi, who are doing some great work. And so if you all just want to chime in and share kind of what you're doing, I've seen a little bit in the chat box already about who's here, but if you wanted to just share, kind of introduce yourselves and share a little bit about the work you're doing, that'd be great too. Because this panel these are people that, we know that we invited to participate, but we recognize that there's a lot of other great work going on in the state too. So I just wanted to give everyone that opportunity as well.
I really want to say thank you for this opportunity, because it's so nice to learn about what other organizations are doing just in our state and being able to connect with them on projects. I have been private messaging Chelesa because we have an event coming up on March 27th on the coast that she will be helping with and providing diapers for. So I'm very excited about it. So thank you for this opportunity.
We're so glad you could join us. There is one other question in the chat about how do the doulas get reimbursed for their services? I don't know if that's something that you would like to speak about, or you can also answer in the chat if that's preferable.
Well, I'll answer. So we're going to train 20 people to go into their community and provide this service. We do not have funding at the moment to offer the payment or a fee for their services, and that is something we're also working on. We're working on that, not only at just me alone, but that's something that's being worked on at the state level and the federal level of getting doulas the right pay that they need. If you inbox me or email me at cpresley@deltadiapers.org, we can talk further about that. I have some things in the work, but I will not share it personally, publicly at the moment.
Thank you. And I've typed that email into the chat in case people want to write it down as well. Thank you. I see one person in the chat says, here at Forest General Hospital, we are still giving in-person lactation support to all inpatient moms. We are thankful for all your work reaching out to our moms. Mississippi needs more doulas, so that program is wonderful. So thank you so much for creating this program and for sharing it with us today. And as we have 2 more minutes, as we kind of start to wrap up this wonderful discussion, I wanted to just make sure that the panelists had a last moment to share anything else that's on their mind that you all would like to share with the group that we have on the call today.
I would just like to, ask for the support of the community, the clinics, the hospital, anyone that touches pregnant moms. When you know of services that are offered, to provide education, I mean, we're passionate about it, and we just want these moms to have a successful outcome. So please refer them to these resources so they can take part in it and become as knowledgeable as possible to have a successful experience. And, you know, reach out to anyone. The health department, they know how to reach their peer counselors. These home visiting programs, they know how to reach their, you know, breastfeeding staff. I even see people from the Healthy Families. I think they're through the Department of Human Service. We've had contact with them as well, and they provide breastfeeding support. So reach out to them. They can, you know, be a guide on, you know, ways to, you know, different resources as well. So just utilize these resources.
I'd just like to say, if anybody on this call who's not already a depot for the milk bank would like to become one, we have depots in outpatient locations. We have them in maternity stores. We have them in hospitals on mother-baby units. We have several at baby cafes. We would love to have more. Right now we have depots in Clarksdale, Tupelo, Columbus, Oxford, Starkville, Meridian, Vicksburg, Indianola, Hattiesburg, Biloxi, and then the one at Gulf Coast that's kind of over, as she said, on the border with Hancock County. But if anybody has a baby cafe or any other place that they would like to be a depot, we are always looking for new depot locations, especially if you're in the middle of an underrepresented part of the state in that list that I just named. So that director@msmilkbank.org would be the email to get a hold of us if you'd like to be a depot. All of the cost is on us and all of the liability is on us. I'll just say that up front.
I also wanted to let everybody know that I put my email address in the chat box. So if anyone has any questions or can think of a way that we can work together, please contact me at MSPHI. And we all have a common passion and a common goal. So I think that we would make a great team. So please feel free to contact me.
We'd love to have a depot in Jackson County.
Okay.
Maybe we can get together on that.
That's good to know, Becky.
My final thing I want to share about our depot, milk depot, which we just took a pink about, Friends of Fins. We named, for those that don't know, it was named after one of our local nurse practitioners, baby who was born stillborn. And one of my roles as a doula, I'm also a grief doula. So I provided grief douling services to her. And one of the things that resources I provided was Mother's Milk Bank of Mississippi. And she pumped and donated her milk to the milk bank for up to 6 months, I think she did. And one of the things she complained about was having to drive so far to deliver her milk. So that's why we reached out and started Friends of Fins Milk Bank, and her whole family came for the grand opening. And it was really, really a touching moment for them. And they was really honored to hear that their baby's name would live on. So that is the story of our milk bank.
Well, thank you. I think that's a touching and a great way to end this panel and this webinar. So I just want to thank you all for joining, for sharing your insights, for being open to sharing your work. And thank you for everyone who's listened in. I hope that you learned something and maybe gotten excited about a new collaboration or something. So thank you all so much and have a great day and rest of your day. And we hope to see you on April 14th for the next webinar in our spring series. Thank you so much.
Thank you.
Thank you.
Everyone.
Bye-bye.